All right, so when we look at Sam, we see this retracted view, and we've already talked about his worn teeth. Now, not all worn teeth are the same, so we want to look a little closer at this. Now, you can see also that Sam has very dark stained teeth from tetracycline. It turns out that his mother, trying to be a good mom back in the day, she prophylactically gave her children tetracycline to help ward off any diseases. And you can see the effect of the high discoloration of his teeth. Now, when we look at Sam, you can see he has an incredibly deep bite. And as we look from the occlusal view of the lower arch, you can see that the wear of the teeth is primarily restricted to the anterior teeth. The question becomes, as those teeth have worn, has there been super eruption of both the upper and the lower teeth, or just the lower teeth? This is what we talked about earlier when we were talking about trying to find room when we open. Do we need to open bites, or can we move teeth orthodontically because of super eruption of teeth from wear? I think it's likely that the wear of those lower anterior teeth are related to the shape and the polish of those ceramic restorations on the upper arch. So we took impressions of Sam, we took a bite registration, we took our face bow, and we mounted it on the articulator. Now, interesting, I said many times when I take these, when we take bite records, centric bite records on patients with worn dentition, very commonly they have an interference, a posterior interference, or there's some sort of bite discrepancy. That is, centric relation is not the same as their maximum intercuspation. Now, Sam, on the other hand, his MI bite, his maximum intercuspation, and his centric relation bite were the same. And the reason for that is because of those over-contoured anterior crowns. They've essentially worked like an anterior deprogrammer over the years, sort of forcing his condyles into the superior anterior position. So for cases like this, it's not unusual that they actually are into centric relation because the teeth have sort of guided them into that position. So we look at the mounted casts, and it's interesting, you'll see what such a deep bite he has in the anterior aesthetic zone, but if you look at the posteriors, there's very little wear on any of the posteriors. The molars look essentially unworn. Now, there is a crown on the lower right first molar, but otherwise the teeth are essentially unrestored. So the question that you should have is, where do we start? Where do we start with a case like Sam's? And I will tell you, the way to start these cases is start with the end in mind. That is, my goal for Sam is to create naturally formed or naturally sized lower anterior teeth. That is my goal. That is the end in mind, is how do I create naturally appearing lower anteriors. Now, we know that lower anterior teeth have a typical size and shape. So typically, the lower central incisor will be about 6 to 6.5 millimeters wide, and anywhere from about 9 to 9.5, 10 millimeters tall, from CEJ to the incisal edge. We know that the lateral incisors are going to be slightly wider, so they might be 6.5 to 7 millimeters wide, but they're going to have the same height, the same length as the central incisors. That is somewhere between 9 to 10 millimeters tall. The lower canines are going to be about the same width or a little wider than the lateral incisors. So those will be about 7 to 7.5 millimeters wide typically, and they're going to be a little longer than our incisors. They're going to be about 11 to 11.5 millimeters tall. So knowing the average sizes and the average shape of lower anteriors helps us then to figure out how do we create this normal size teeth for Sam. Because really there's only two ways that I can make the teeth longer, right? How do we make the teeth longer? We can add to the incisal edge, right? And as we add to the incisal edge, we have to understand that we're going to be changing the occlusion. We're going to have to open vertical dimension, because as those incisors get taller, then as we make more height on those, will mean that the back teeth aren't going to touch, which means then we'll have to add to the back teeth so that we can still have a stable occlusion. So if we add to the incisal, it means we're going to have to open the vertical dimension. The longer that we make those lower anterior teeth, it may become an aesthetic issue, or it may become a phonetic issue. or even a functional issue. So we may be limited to how tall we can bring those incisal edges. So if we have one way that we can make the teeth longer by adding to the incisal, there's another way we can make the teeth longer, and that is to reduce the gums, or that is to move the teeth down, or move the gum line down, or remove gum tissue. So that was a conversation that I had with Sam. With Sam, I have a couple ways that I can make your teeth longer, that I can make them to look normal. I can add to the edge, but I'm limited how tall I can make those teeth because I think aesthetically they're going to be coming up above your lower lip, and aesthetically it's not going to look right. What I'd like to do is consider, can we lower the teeth? And there's two ways to lower the gum line on patients. We could put braces on the teeth, and with orthodontics we could intrude the teeth and lower the teeth orthodontically. Sam said there's absolutely no way he's going to wear braces, and he was not going to consent to wearing Invisalign. So orthodontics was not an option for Sam. So I offered up the option of just doing crown lengthening or lowering the gum tissue to expose more tooth structure. That would be beneficial because then I would have more tooth structure to grab onto, which would make my restorations more durable, and it would also give me the opportunity to make the tooth longer going towards the gingiva and then add length incisally, so I could do a little bit of both. That is, lower the gum tissue to get length that way and add height to the tooth incisally. So that's what Sam agreed to. He said, okay, that sounds like a good idea. Let's go ahead and plan on doing some crown lengthening, and I can then also add some to the incisal.